Hey, it's Adam Sewell, MD, and welcome to Module 5 of the Microplastics Toxicity Training, certified by the Microplastics Health Alliance. In this module, we're shifting from diagnostics to treatment. You've learned how microplastics enter the body, how they accumulate in tissue, and how they disrupt immune, endocrine, and neurological systems. Now we're going to explore what we as clinicians can do about it. This module is built to be practical. Each section will walk you through real strategies to reduce exposure, support detoxification, lower inflammation, repair tissue, and restore physiological balance. This isn't theoretical. We're drawing from clinical trials, mechanistic studies, immunohistochemical models, and patient outcomes. We're going to begin with the foundation, what I call the systems-based framework for microplastic detoxification. This is the mental model that ties everything together and helps you design safe, effective, and scalable treatment plans personalized to your patient's physiology. Section 5.1, the systems-based framework, 4 pillars of detoxification. Let's start with a reality check. The human body was never designed to handle plastic. These are synthetic polymers that didn't exist in nature until 100 years ago. We don't have enzymes to break them down, we don't have dedicated excretory pathways, and yet we are constantly exposed to microplastics, nanoplastics, and their plasticizer residues through food, water, air, skin, and even medications. So if we can't enzymatically degrade them, how do we help patients eliminate them? We support and optimize the systems that reduce toxic load, what I call the 4 pillars of detoxification. Pillar 1, reduce ongoing exposure. This is always step 1. There's no point trying to detox a patient who is still drinking 5 plastic water bottles a day, microwaving food in Tupperware, and using synthetic personal care products. As we discussed in Module 4, the MHA clinical screening tool helps identify hidden exposure routes. Once identified, you need to coach patients, clinically and behaviorally, on how to eliminate those exposures. Clinical reference, Rudel et al., 2011. Environmental health perspectives showed that removing plastic food packaging reduced urinary BPA levels by 66% in just 3 days. Martin et al., 2022. Environment International, lifestyle interventions to reduce endocrine disrupting phthalate and phenol exposures among reproductive age men and women, a review and future steps. Pillar 2, mobilize retained particles and residues. After exposure reduction, we focus on mobilization, getting retained microplastics, BPA, phthalates, and related chemicals moving toward excretion. Here's where it gets interesting. Microplastics are not just floating in the bloodstream, they embed in tissues, especially fat, liver, gut mucosa, and even brain. Plasticizers like BPA accumulate in adipocytes and interfere with nuclear receptors. Mobilization means activating liver conjugation pathways, repairing bile flow, and restoring intestinal barrier integrity to reduce enterohepatic recirculation. Key interventions. Support. Phase 1, cytochrome P450 cruciferous vegetable sulforaphane. Support Phase 2, conjugation, glutathione, N-acetylcysteine, S-adenosylmethionine, vitamin B6, glycine. Support bile flow, dandelion root, phosphatidylcholine, taurine. Immunohistochemical model, plastic-laden tissue shows upregulated tumor necrosis factor alpha, interleukin-6, and cluster of differentiation 68 plus macrophage infiltration, especially in GI biopsies. Restoring hepatobiliary clearance reduces local and systemic inflammation, Choi et al., 2018, Liver International. Pillar 3, enhance elimination pathways. Once toxins are mobilized, we need to ensure they exit the body. That means optimizing all 4 major elimination routes: stool, urine, bile, and sweat. GI excretion, fiber, psyllium, acacia, binders, charcoal, bentonite, cholestyramine. Renal excretion, hydration, magnesium, taurine, glycine. Sweat excretion, sauna therapy, exercise, niacin support, bile drainage, bitters, lecithin, beetroot, milk thistle. Clinical reference, BPA BUS study, Genuis et al., J Environmental and Public Health 2011/2012, found that BPA, phthalates, and other EDCs were present in sweat, but often absent in serum and urine, highlighting the importance of sauna and induced perspiration. Pillar 4, repair and regenerate damaged tissues. The final pillar is regeneration. Microplastic toxicity doesn't just intoxicate, it injures. We see mitochondrial fragmentation, reduced BDNF in the brain, epithelial barrier breakdown in the gut, and endocrine receptor dysregulation in hormone-producing tissues. Therapeutic tools, mitochondrial support, coenzyme Q10, pyrroloquinoline, quinone, carnitine, magnesium, neuroregeneration, BDNF support with omega-3s, rhodiola, lion's mane, GI mucosal repair, L-glutamine, butyrate, zinc carnosine, hormonal restoration, DHEA, adaptogens, estriol or testosterone, case-dependent, immunohistochemical correlation. In rodent models, after microplastic exposure, hippocampal tissue shows reduced NUEN expression, neuronal nuclei marker, increased GFAP, astrocyte activation, and elevated INOS, indicating neuroinflammation and oxidative damage. Therapeutic reversal of these patterns with anti-inflammatory and neurotrophic factors has been demonstrated in multiple studies, including Yang et al., 2021, Exploration, Systems-Based Timeline, the 4 detox modules. Before we close this section, let's walk through the patient-facing model we introduced earlier, the 4 detox modules. Module A, time frame, days 0 to 14, target compartment, GI tract, expected clinical change, bloating decreases, stool regularity increases, nausea decreases. Module B, time frame, weeks 2 to 8, target compartment, circulating plasticizers plus bile, expected clinical change, energy increases, mood decreases, appetite normalization. Module C, time frame, weeks 8 to 24, target compartment, liver, fat, endocrine tissues, expected clinical change, hormones rebalance, sleep and libido improve. Module D, time frame, month 6 to 18, target compartment, brain, CNS, intracellular spaces, expected clinical change, cognitive clarity increases, fatigue decreases, mood stabilization. Tracking patient progress through these phases keeps them engaged and helps you measure the success of your intervention. To summarize, detoxification from microplastics isn't about collation or guesswork. It's about applying systems medicine to a synthetic burden. Remove the exposure, mobilize what's stuck, eliminate what's mobilized, and repair what's been damaged. In the next section, we'll get granular on exposure reduction, how to counsel patients, change their environments, and track reductions in urinary plasticizers and symptoms with the MHA toolkit. Let's keep going. I'll see you in section 5.2.